Сайн байцгаана уу хүнд үзэгчдээ. Өнөөдөр манай де факто нэвтрүүлгийн зочноор сая Монгол шинээр томилогдсон UNICEF буюу хүүхдийн НҮБ-ын Хүүхдийн Сангийн Суурин төлөөлөгч ноён Эваристе Kouassi-Komlan ийм хүнтэй ярилцах гэж байна.
Эваристе Kouassi-Komlan Монгол дахь нэгдсэн улсын байгууллагын Хүүхдийн Сангийн Суурин төлөөлөгч. Нидерланд улсын усны Боловсролын институтын ашиглалтын менежментийн магистрийн зэрэгтээ Их Британийн Кембрижийн сургуулийн ЖЖ нэрмжит бизнесийн сургуулийн удирдлага хөгжлийн сертификаттай. Нью-Йорк дахь нэгдсэн улсын байгууллагын Хүүхдийн Сангийн төв оффист ус хангамж, ариун цэвэр эрүүл ахуйн ахлах зөвлөх болон нэгдсэн улсын байгууллагын Хүүхдийн Сангийн дэлхийн ус хангамж, ариун цэвэр эрүүл ахуйн хөтөлбөрийн дэд захирлаар ажиллаж байсан. Дэлхийн банк, олон улсын усны нөөцийн төв ERC, Бил ба Миландагийн эзэн сан, Америкийн хөгжлийн банк, Африк болон Азийн олон улс орнууд дахь сан, засгийн газруудад зөвлөхөөр ажиллаж байсан.
Good evening.
Good evening.
Welcome to Mongolia.
Thank you. We're happy to have you.
I have seen recently your very broad interview, which to the local newspaper, which provoked me to talk on our program. Thank you very much for coming on our show. So let's start from your 4 years plan. Like any UN agency, you made your country plan. Right? Tell us about the plan. What's new in that?
No, thank you very much. And we are very happy that Mongolia has been, Mongolia government has been very supportive to UNICEF for many years, 60 years already. Our footprint in Mongolia, and we have had a very good collaboration over many, many years in different aspects. And lately, last year, September 27, in New York, our new country program 2023-2027 has been approved by the UNICEF Executive Board, which is a big milestone for us because it's not only UNICEF as such, but also through the Ministry of Foreign Affairs, the many other ministries contribute together to work with us, including young people, to develop this 5 years plan. Very instrumental for the country where we are moving through multi-crises to more development process in different areas. So this new country plan builds on what exists before, all the progress that we have done before, all the achievement that the country has made in different areas. Health, where we have seen under 5 mortality reducing a lot. And then we will be working on education, for example, where huge progress, nearly everyone is going to school in Mongolia. Child protection, where there's a lot of legislation has been put in place. And climate change, where the government has made a lot of strategy to reduce air pollution and also address some of the climate-related issues. Water and sanitation, where you have seen a huge increase in terms of access to water to many households in the country. And also the last one is shock responsive intervention, particularly commanding what the government has done in April 2020 to top up some of the resources for the children as well. So we build on that to develop our new country program that will focus again on 5 main areas that are listed above.
Okay, let's drill into each of them.
Yep.
As these are so important, crucial factors of our life, in particular, I touch seriously and deeply children.
Yep.
So let's start with health. First of all, you said that yes, children, the child mortality had decreased substantially, but however, still we need to improve. And what we will do in this regard?
So for many years now, the whole under 5 mortality in the country has been, the rate has been very stagnant. And we need basically now to make sure that we curve it better. And by doing so, for us, our new program has few strategies. First of all, we need to work more on primary health care system strengthening. which means basically from the whole womb, where the mom will start, getting the baby till the baby is out. We need to make sure that there's a clear monitoring system in place to monitor all those. And when the child is born as well, that we have diagnosis, treatment process in place so that we can reduce the under 5 mortality on the way. That will include also nutrition, addressing some mental health issues. So in our program related to health specifically, we'll be focused more on early detection of the children, which is one of the areas that we pay more attention to, because by doing so, we'll address some of congenital disease that the children is facing, and then we can operate some of the correction in the beginning before the children start growing up.
You said the mortality rate under 5 years old children keeps staying stagnant in the country. At which level, and compared with, say, neighbor countries, any statistics?
So, if I can just say a few statistics, just looking at some of my file that I have, and we have seen that for many years, this under 5 mortality has been stagnant in many ways, because the progress that the country has made was quite instrumental. And we have seen, according to the data that you have, is more or less 21 per 10,000, which is a very good progress compared to many other countries. I'm comparing for example, to Indonesia or to Timor-Leste, for example, where they are still high. But this country has basically maintained this level for many years now. But the point is how we need to curve it down to compare to some country like Japan, like South Korea, where there's
what is the per 10,000 people? Per capita, 10,000 capita.
Yeah,
right?
10,000, yeah, per 10,000, yeah. So in Mongolia, it's 21 per 1,000, which is basically huge, and we need to do a lot of work basically to reduce that as well. So it's where we are basically working on together with many partners to make sure that we address those kind of issues related to under 5 mortality in the country.
Overall, for example, Japan, the growth of population is almost minus.
Yeah.
A country like Mongolia is relatively up.
Yeah.
And we're looking every year for new schools. Meanwhile, in many countries, they are closing down schools, for example. So in that sense, if we decrease that child mortality, then what a chance for us to increase the population growth?
So, if we have seen a trend from 2019 to 2020, for example, in the country, so this under 5 mortality rate decreased a lot. So it means that we are having more babies surviving, basically.
Already for this 2-3 years?
Yeah, but the past 5 years, more babies are surviving, basically. So the thing that we need to do is like, how do we make sure that more babies survive as well, which is very important, and then they will be decreasing the mortality, meaning that we need to prepare the whole education system basically to cope with that as well, which is some of the challenge that you also
Yeah, you
need
said
to
that
find.
about the pre-detention of diseases in the womb of mother.
Yeah.
And the equipment, I mean, all these other conditions are here. I mean, what we need, new equipments or teaching the professionals?
So I've been touring 11 provinces now. Some of the requests or some of the demand that we are receiving basically from those provinces and hospitals is more sometimes a skilled nurse basically who can basically help delivering the children. And in some of them, I say, okay, if you know the condition of the children in the womb of the baby, of the mom, we can already basically prepare, if the baby has some heart disease, some lung disease, so that we can address all those.
Can we find that in each IMAG or each
So
Somon? Or
I'm very happy to announce, the first equipment of neonatal screening. Is now available in the country. They can do the test, and I was there with the University of Nurse and medical university professor last week to open one of these centers together that UNICEF has funded as well.
Oh, center in Ulaanbaatar city?
Yeah, in Ulaanbaatar city, where they can do some of those tests in the beginning for the kid that will basically help detect some of the disease that the children have.
And training as well of our nurses.
Exactly. You need to train some of the nurses.
Shall we have in each IMAG that?
So the challenge we have is like the sample that need to collected is not a fresh blood sample. You collect it it's a dry blood sample that can be collected, meaning that anyone can transport it and bring it to the center here, which has a capacity that more than 200 tests a day, which is a huge number they can perform. So the capacity is huge and available, and then we can do a lot of work based on that as well.
So this is one equipment is in the country available now.
It's enough. Actually, it's enough based on the number of babies that
200 mother a day can be tested.
Yeah.
Which down the road, I mean, this machine can show if there's any abnormalities.
Yeah, they have 7 key conditions. Now they can detect it on the children very quickly, which is a very good advance. And we are thinking also to provide more support so that they can detect more.
Is it at the medical university?
Yeah, this one medical university here.
Here.
Yeah, which is
doing that. This is very nice to hear that. And this is if a day 200,000 mother can be checked, then it is more than enough, I think.
Yeah.
Not that many. Yeah. Let's go to the other aspect about education.
Yeah.
Education, well, for me, for example, education is a matter of accessibility, quality, and teacher salary, and existence of 2 systems, private and public.
Yeah.
So what is your take on the issues we face now?
One of the challenges I used to see in education is like the country is doing well and nearly everyone is going to school. Every child is going to school, which is good, and the completion rate for the primary education is also very high. I think it's 93%, which is very commendable at the age. So, but what we have seen, there's a lot of disparities between a very rural area, had a nomadic pastoral living area in the city compared to the city. And we have seen also during COVID-19 time, this situation has been exacerbated as well. And those who don't have access, this gap has been increased. And we have been working as UNICEF to provide more online learning and also offline learning through some of the equipment that we have developed for those living in the pastoral area. A small radio with loaded module for the children basically to use for their course, and this has been a very great support for many families.
Oh, what you're saying is those families who has not internet can have access through radio.
Exactly.
And the radio program, the physical radio were provided to the families?
So, yeah, so we have now produced more than 4,000 of those small equipment that we are distributing, loaded with a different module with the book that we are distributing to many families basically, and so that the children can basically access to some of the modules.
Classes to go. It's like in Mexico, remember?
Yeah.
They were using this also, radio, FM, AM even.
Yeah.
How about our radio? It's FM or AM?
No, but this one is more loaded through internet system and Bluetooth. Then
that can be used also offline?
Yes, it can be used.
First of all, loaded online, then
you can use offline.
Then who is providing the content? The same content which is online for other people?
Yeah, exactly. The same content online is uploaded in this so that the children can be on the same.
So 4,000 are distributed already.
Yeah, available, distributed already in many provinces, many MAG as well.
IMAGs and SUMs.
SUMs, yeah. And also during my last visit in some of the ZUD affected area.
Well, okay. Okay. So nice to hear that you are increasing substantially the access of those families who has not Wi-Fi to the content.
Yeah.
Okay, on education-wise, what is your take on the big differences between quality of private and public schools in the country? And because that in Ulaanbaatar, for example, you know, from very remote area, they're driving their child all the day to the center to better schools, then go back all day, and that mother doesn't work otherwise anyway.
Education system has been a very complex issue, not only Mongolia, but in many countries,
Yes.
right? Because most of the parents, they want to do the best for their children,
Yes.
and then see where some of the schools have a better track record in
Yes.
terms of, the level of success that they have in school. And this is the same challenge we have, is why, you know, someone in horror 6 will drive the kid to horror 20, for example,
Yes.
you know, and create some traffic jam on the way. But I think the fundamental one is how we can bring something like equalizer of education system that makes sure that someone in horror 6 can have the same education on the same educational content and quality like someone in horror 21.
Yes.
So this is one of our dream as well. And then it's why in most of the country, including Mongolia, the private school are offering those because they are more in advance. They can bring innovation, they can bring technicity, they can
They are
bring
more funded.
money. Yeah,
They're
they
more
can-
funded
exactly.
by their parents.
Exactly, they
And
bring more money.
So it's first of all, for public schools, it's a matter of funding.
One of the issue is also funding as well, but also the second one is more the infrastructure issue, which is sometimes quite a bit challenging because, like I say, the private sector has this opportunity to bring more innovation and to bring better infrastructure and also innovation in the system, and it can attract. It's more business, you know, things. It's why you see this huge difference between the private and public school most of the time. But I think if you manage basically to have the same content, like the content that is provided in private to the public as well, vice versa, you can, you know, lift up together the whole education system.
Okay, yeah, I do agree with that, and it needs more infrastructure, funding, and innovation. In terms of school, we call it school food or school lunch.
School meal.
Yeah, school meal. They have, I think, converted from school tea into school lunch, kind of.
Yeah.
So what is your assessment on this school meal program in the country now, currently?
So I've been in some of the school when they were delivering lunch during lunchtime, and the quality of school meal is still good because myself I test them. I eat some of them, which is fine for me. Most of the challenge that you're having on the school meal, what you can perceive is the quantity and then the sustainability aspect, because some of the school might not have a lot of resources basically to maintain the same quality over a period of time. And they can do in the beginning, but I think the variety or...
What is the best practices in the world where a state can make sure that they have equal quality of food all around the country?
It's the same thing. I'm not talking about a full privatization, but I think when it's like, the same thing when you go to in the plane, right?
Yes.
The plane food has been totally standardized, and then you know that you are doing everywhere.
And then your food is exactly the same as soon as you are in the same class.
Exactly. So I think this is what we are trying to do as a UNICEF and training those cooks in the schools so that they can basically make sure that the composition and the way they prepare the food remain standard all over the place in all the schools. And our nutrition program is working hard with Ministry of Health and Public Health to make sure that those modules that we develop for the cooks in the school is something that is practiced basically, and in some of the schools, we have provided the whole equipment of kitchen so that people know exactly how they can do those kind
like airplane catering system.
Very quality,
Quality.
catering for the kid is something that you might aspire for as well. And if you have the same, because nutrition is very important for the children's brain, and if you don't have a variety of the food that we offer to the children, it can also, with nutrition food, we can impact also the
We talk
the brain
about
issues.
school meal. How about, say, the children under 6 years old, which is so important period of nutrition? If they are under nutrition, then they would have a bigger problem down the road in their lifespan, right?
Yeah.
And in that sense, how one can make sure that every children in the country, every child in the country, having more or less that level of calories, contents. What is in Mongolia now?
So we used to say if you change the beginning, you can change the story, right? It's the same thing applicable for the children as well. And if you change the story, beginning of the story of the child, providing appropriate food, appropriate nutrient at this age, we can make sure that we create a very good active citizen at the end of the day. And remember, between 0 to 3 years old is where 80% of the brain of the children is developed.
Yes.
If you miss this opportunity, basically not providing a good quality of the food for the children so that they can have a lot of nutrient to develop the brain, we are totally failing the children.
That's what is now more or less parents start to know. But however, this country gives 100,000 tugri per month per child. How one can make sure that this money, in particular for the child under 6 years old, are coming to the brain? Is a good food?
No, it's fine. So the good thing that we have also in the country is the whole capacity to have different meal and to prepare for the children. And I think there's a lot of work that has been done already to make sure that these food that the children are eating in the school have a good composition so that they can basically
I'm talking about at home,
Yeah,
where
so-
many of them are staying at home.
Yeah.
Under 6 years old. Not everybody is covered. Though in Ulaanbaatar city now they are covered by kindergarten.
Yeah, kindergarten and then school meal as well. So at home, I think it's the same thing. This education has to go not only in the school only, but in the household. So just to give you one example, we all used to say that the children is a good transmitter of message, right?
Correct.
From school to the household.
The best conveyor.
Exactly. So the conveyor. Okay, look, if the children used to have a standard of food in the school that doesn't appear in the house, the children can complain.
Yeah.
Say, okay, I eat this one in school, I prefer eating this one. And then they can become more demanding because the quality
Very
is
good
there.
connection, at least. Yes.
So this is why those messages that we are promoting, developing some of the key manual for nutrition for the children for school, and there's also this one for the mother as well, so that we can have this transmission going on from the school to the children. Now, each of the family has totally different setup. Some of them are wealthy, some of them are not wealthy, and then based on
Do
that,
you support then the line that some say every child should have money? Some now the government put 10% will not take it, which caused some problem. And what is your take there? Because maybe about 20% or so of the country income, it's not necessarily they have that 100,000 per month per child.
Yeah. So my point of view on that is this is more political decision. It's more based, it's not economical and many other, but it's more political decision. And this the same political decision was taken in April 2020 when they want to top up the money to 100,000 as well. So as a UNICEF, we always if everyone can get it, it's fine, it's good. But the challenge is that there's a lot of factors that play whether everyone should get it or everyone should not get it, and this is where UNICEF is still ready to continue supporting the government on any way they want to go to make sure that we have appropriate support for the children.
Then let's now logically talk about another issues with the children, which is a child protection from the domestic violence, of any other violence, in fact. So what is the situation in Mongolia now compared with other countries, and how efficient we are to tackle this kind of problems?
Child protection issue is a very huge issue, and we have seen a lot of progress as well in the country. We cannot see that a lot of progress. Violence against women and children remains something that we continue to see. That violate many children's rights as well in different aspects. But our program has helped a lot the country to develop a lot of program to help the government to have a lot of training capacity to make sure that at least the system for the response is there, which is good. And if some of the women have some issue in the house, they can have a safe space. Or if children has been abused, they can have some safe space. Those are some of the progress that has been made. In the same time that, the protection issue is like the range of bottleneck issue. Once you solve one, another one pop up, right? Which is when, we are working on child protection, domestic one, and down now coming online protection issue, safety
the other issue, yes.
And that is coming, and particularly that has been aggravated, during the COVID-19 situation where...
not only in the family or by the parents, but also among themselves.
Among
school
the
bullying.
Bullying, all those kind of online bullying.
Which is becoming very severe now online. Is it right that, for example, some schools asking kids have a Facebook page, and once they have the page, once they have access to the Wi-Fi to that page, they can have access to other, not necessarily important or good contents.
So we have seen like some of the children, they have 2 or 3 or 4 Facebook pages as well. And then, there's a lot of manipulation going on. And one of the key things for us is how the parent can take a control, can be upfront and educating the children on those kind of issues.
So they may have pages, but parents need to control.
They have to, and they have to play a huge role in the...
But there are parents who cannot even
so it's why,
understand Facebook.
It's why I know that some of the parents cannot even create Facebook, but I think it's our role, a collective role as stakeholder in this platform to see how we can have a better campaign informing parents on harm, on the issue that we can have on those kind of social medias. I also know that there's some of the credit line that the children can get through online system very quickly that can put them in debt as well. But those things need to be controlled somewhere.
So at the same time, when the school asking them to open on page or to their businesses run through their pages, at the same time the school are obliged to teach the parents how to control Facebook.
Exactly.
Right?
So they have to lead, and it's why in some of those, in some of country, the role of parents, school parent, community that support the school are very predominant. And those are the instruments that guarantee that information flow between the parent around the school community. And it's something that is very important. And if you want basically to have those kind of control mechanisms and make sure that the supervision of the children, we need to have those kind of safeguard mechanisms around that. If not, there will be page creation that will create more harm than, and this open the door to many predators as well that can basically infiltrate it because of the safeguard issue of internet and all those kind of issues that we are seeing.
Let's jump quickly on 2 issues, which is very big issues. One is about the access to water by children. It's basically, we talk about households, Vagar district. So what are what particular measures you are going to take on that? We know the problems, but how you is UNICEF to handle or help to handling?
So for many years, I think Mongolia is one of the countries where the access to water has not been a major issue for many households. But during the 2015, when the SDG has been launched, globally there's what I call the ball game who has changed, that many people call more about sustainability and also quality of water that we need to provide to the many households. We totally changed the way that we need to address the water in a holistic way. And so those people those countries or those communities, those households who have made progress before, those progress has been jeopardized by those new indicators that we have now. And in water sector, they call it safely managed water services, meaning that it's not just only the water that you just drink borehole and supply, but you need to make sure that this water has all the quality, bacteriological and chemical, free, respecting WHO, World Health Organization guidelines.
What is our statistics of success?
So in terms of safe, if I say safe water, for example, in Mongolia, we are talking about safely managed water, we are talking about 30% only, compared to access, which is more than 80%. So the ball game got changed, in meaning that we still have some of the quality issues in the water access in the country that need to be managed.
Two issues. One is housing conditions in bigger cities. The second issue is to purifying waters in countryside, making sure that it meets standards. Right?
Yeah, exactly. So WHO standard, which is very important because some of the heavy metal you can find in water can be very harmful for the children, can create a lot of disease.
Do you have a particular program to help within your 5 years plan?
Yeah, so this is one of the biggest program in water and sanitation to improve the water quality for many zones. And we have started working on that already, providing support to some of the centers, MAC, with a better filtration mechanism, better diagnostic of the groundwater situation, and make sure that we collectively ensure that we have a system in place to ensure continual water quality over the whole for many households and many families.
Since you are professional in this field, you have studied at the best institutes, you have been advisor to all UNICEF-related actions on this regard for the last 20 to 30 years. You have been advisor to Gates and Melinda Foundation, etc., exactly on water access and water supply. And I hope during your work in Mongolia, hopefully we will have more new discovery of our problems and even more solutions to that.
Yeah, no, thanks very much. And with the Bill and Melinda Gates we have done, my consultation and support was there is more related to financing and cost recovery in water and sanitation. Mm-hmm. This was in two countries, in Burkina Faso and Ghana, on cost recovery issue, where there's a challenge on how do we identify the costs, all the cycle costs related to water system. That's something that is not done before, and we have done that. And in Mongolia, some of the challenge we had to face, and I used to explain the same situation of water service provision, like you are buying Osho, right? Very simple. If you are producing Osho, and today Osho is very good, tomorrow Osho is not good, what will happen? People will not buy it, right? If the next day Osho is not good, people will not buy it. Or some people will take it, but they will not buy it. Give the money. It's the same thing in the water sector as well. Today you produce a very good quality of water, people are happy, no one is sick, but tomorrow if the quality is...
Consistency of operation.
Yeah. And then people will not go there, and then your whole financing and recovery system will be jeopardized. So one of the key is if you want to improve water system, you need to make sure that we understand the full cost of operation of water supply system in Mongolia.
It costs a lot of money.
It's
I
a
saw
lot of money.
Hamburg Sum
Yeah.
water purification system project made by OT.
Yeah.
And the people were saying that, wow, this is completely different water than we were drinking before. So it makes big change, I think. Water
Exactly,
is the
yeah.
air, water is the beginning of life. So
Exactly. So we need to make sure that the consistency of the quality of the service that we are providing through many years, and then it's not only for the same people, but the population is increasing. So you need to maintain the quality, and then make sure also that when there's expansion, you provide the same quality for those people who are in the expansion area, which is quite challenging. So here is a point. If we continue providing water services for free, we are not giving the right signal.
So
at the end of the day,
it will have a cost.
it has a
substantial
cost, and
also sustainability of that operation.
sustainability
Yes.
of the operation will be jeopardized. So this is a message I want to convey. I'll continue to convey here, to making sure that we have a sort of reform in place that basically will turn around the way that we look at the water and address
I
the
wish
water
our
sanitation system.
related authority to know more from your experiences. Where is
Yeah,
the
I'm trying
cost
to
and-
do that. Wherever I go, I try to do some briefing on those kind of issues.
Please do it in each IMAC you visit,
Thank
each
you
song
very
you
much.
visit, and
Yeah.
that at least they will understand
Yeah,
that
yeah.
there is nothing without
Yeah,
cost.
yeah.
Okay, Evariste, our time is gone, and so happy to meet you and to talk about the
Yeah, I'm very glad also.
issues
Yeah.
faced by the children of the country.
Mm.
So I wish good luck for next 4 years, and I hope before you complete your mission here, we talk again based on what we have talked today.
Yeah, no, thank you very much. I just want to add few points, basically, particularly on the progress made by the country on maternal and child health between 2000 and 2019. This has been remarkable, and we need to make sure that we work on that. The under 5 mortality rate has decreased a lot from 42 to 16 per 1,000 life birth, which is very, very important for the country.
Almost 3 times.
Yeah, so where
2019?
Yeah, 2019. So it's a huge progress that we need to, wherever we need to pinpoint, need to say that this decrease was very huge, and also the infant mortality rate has dropped from 32 to 13 per 1,000 life birth.
1,000.
Yeah.
Okay.
33 to 13 per 1,000 live birth. So
A good jump.
It's,
And almost the longevity.
yeah, exactly.
10 years increased.
10
for
years
this
more or
period.
less,
Yes.
which is a very good thing. And those statistics are very important, and we need to reflect on and see how we can basically work to better.
Well,
those
this,
kind of things.
with this good note, let us complete our dialogue today, and we'll look for our next interview.
Thank you very much. It's a pleasure
you,
to have to receive me.
Thank you.
Thank you.
За хүн төлөвчтэй өнөөдөр манай de facto нэвтрүүлгийн зочноор энэ НҮБ-ын Хүүхдийн Сан гэж байдаг. Тэрний одоо суурин төлөөлөгч ноён Эваристе Kouassi-Komlan оролцлоо. Баярлалаа.